So good morning, everyone. This is Janet. With me on the line today is Chris Albrecht. She's our Executive Director, and Paul Curry, who is our Research Educator, Occupational Health and Safety Consultant. So I'm just going to repeat that, and then I will start the broadcast. So good morning, everyone, and thanks for joining us. This is Janet. With me on the line today is Chris Albrecht. She is our Executive Director of NSNU, as well as Paul Curry, who is our Research Educator, Occupational Health and Safety Consultant. I want to say a few things before we get going. If you have questions during the broadcast, you can email them to nsnu.office.ca. Chris will receive those questions, and she will ask me at the end of the broadcast for the answers. If we run out of time, I don't suspect we will, but if we do, you can still send in your questions, and somebody will get back to you within the next 24 hours or so with the answers. At any time you have questions that are general in nature, you can ask them through that email address, nsnu.office.ca, or you can contact your labor relations person. We have a labor relations staff working full-time from home, answering questions each and every day, whatever the question may be, if it's around your vacation, if it's around PPE, if it's around whatever it is that you're concerned about. You can discuss it either with your local president, or you can contact NSNU, and you will be contacted with one of your labor relations person, and they will get back to you. Keep in mind, though, that because everyone is working at home, we have a tremendous amount of emails that we're answering, so it may take a bit of time to get back to you, but somebody will get back to you. I promise you that. So you can, again, nsnu.office.ca. If you have questions during the broadcast, you can send them in, and Chris, at the end of the broadcast, will ask me them. Or alternatively, you can ask at any time. This broadcast will be recorded and up on our website so that nurses that are working, that are off and have other better things to do on this beautiful day, or are sleeping, can listen to it at another time. Before we get started, though, since we last chatted, we've had a tragedy in the community I live in and in the province you live in. We lost, tragically, two of our VON staff people here in Colchester County. It was devastating, not to the VON family. It's been a rough couple of weeks, and our prayers and thoughts go out to the families of those VON staff, also to, obviously, their coworkers who are struggling, trying to make sense of something that you can't make sense of, as well as the clients that these ladies had visited frequently in that community. And as you know, VON nurses become very close to their clients, and these two ladies had a regular client base that are also affected by this needless tragedy. So our hearts and sympathies go out to those families and the families of the rest of the victims that went through that unimaginable situation we had here in Colchester County.
Hi, Janet. Thank you. You're clear to go now. We're all set. And the email address to send questions is nsnu.office@nsnu.ca. Thank you.
So, Colleen, did they not hear what I just said?
They did indeed, but you're good to go now. We have everyone on the line.
Okay. All right. Now, once I clear my throat, we'll get started. But again, for those that just joined, we were just talking about the two VON staff members that were tragically taken from us last week here in Colchester County, and our sympathies to the families, to the VON local, to the VON family as a whole, provincially and nationally, as well as the clients that these ladies saw with such love. Okay, so what have we been doing, NSNU, while you, the frontline workers, have been in looking after residents in long-term care, people in their homes, our community nurses, as well as our acute care nurses? Well, obviously, we've been very busy. We are in constant contact with our employer and government representatives to ensure that the high priority is placed on the safety of our nurses and other healthcare workers. We have a call each and every day with the Nova Scotia Health Authority to discuss issues around labor relations, PPEs, deployment of staff, all of those kinds of issues that affect you and your work life every day. We have a call once a week or more often, depending on the situation, with the IWK to discuss issues around the IWK. And our labor relations staff are talking to our long-term care administrators frequently if they have any concerns or issues surrounding COVID and other things like moving, sick time, any of those labor relations things that are still going on that our staff have to deal with. So trust me when I tell you that all the staff at the Nurses Union are still working full-time and beyond to represent you during these challenging times. Paul and Justin are continuously looking at issues around OH&S and other issues and answering questions all the time. Colleen and her communication staff are updating our webpage, our campaigners that you're getting a lot of, and because we think it's important information that you need to have, and Facebook and Twitter, and keeping our members in the loop. And of course, we can't do any of that without our support staff helping us get through this challenging time. But we, the NSNU staff, are very appreciative of you, the frontline staff, because you're out there putting yourself and your families at risk. We know this is something as nurses that we do each and every day, not just during COVID-19. We know that oftentimes we look after people that could be infectious or could be dangerous or could be, so it's not just today that healthcare workers put themselves on the line to care for their patients. We do that, you do that every single day that you walk into a facility or into a home or into a long-term care residence, not knowing what the day could bring. So thank you on behalf of the nurses unions across this country, and thank you on behalf of Nova Scotians for doing what you do. So some of the things that I want to talk about is we still have the ability, you still have the ability, if you feel that the collective agreement has been broken, you're not getting what you deserve, you're not getting whatever, we still have an active grievance process. People are still filing grievances. Our LRR staff are still talking to members every day. That has nothing to do with COVID-19 and everything to do with the grievances or issues around their employment. And we continue to do that, and that service is still available to you. If you have issues around that, please call or get in contact either with your local president or your labor relations staff. If it's COVID related or not, everything just didn't stop because of COVID. Unfortunately, it's made it more challenging, but it hasn't stopped. Some of you may know or may not know that the unions in this province, including NSNU, NSGEU, CUPE, Unifor, and IOUE, I think they represent the paramedics, we have signed a Good Neighbors Protocol. We did this a few years back, but we just sort of took it out, dusted it off, looked at it to make sure it still applies. And you can take a look at that at www.nsnu.ca/Good Neighbor Protocol. And in that, it describes what it is, what a Good Neighbor Protocol is. But in essence, what it means is, I'm Janet Hazelton. I work at the Aberdeen Hospital, and I want to go work in the COVID unit at Glenhaven Manor because they have some significant challenges around nursing. I would speak to my manager, who would make the arrangements with Glenhaven, and I would be sent to Glenhaven. My collective agreement, the one that I have with the Health Authority, remains in place. All of the things that I enjoyed with the Health Authority remain in place when I go to the Glenhaven. There is no change with my benefits, my pension, nothing. Nothing changes. It's just like I've been sent to a different unit at the Aberdeen, but instead I've been sent across the parking lot to work in long-term care. So that, in essence, is a good neighbor protocol. But you can't just do it on your own. You need to speak to your nurse manager. They need to decide whether or not they can free you up to go help at the Glenhaven, and then they make arrangements with Glenhaven. This has happened on a few occasions since this COVID-19. At the RK, McDonald in Antigonish, some VON nurses were sent in there when they had staffing challenges. At Magnolia in Enfield or Elmsdale, the same, and again at Northwood. And on behalf of everyone, the NSNU, your coworkers, and the province of Nova Scotia, we want to thank those nurses that went into what is arguably an unknown situation. Everybody knows how uncomfortable it is for people to go from their familiar surroundings and go into a situation or a unit that they don't know the other nurses. They don't know exactly what they're getting into. Like, I'm going from acute care to long-term care. We all know that that's a different kind of nursing. We all know that there's different and unique challenges to go from acute to long-term care, and we thank those nurses that went into these environments and offered our colleagues in long-term care a hand. They were really hurting, and trust me when I tell you, the nurses that I've talked to in those facilities so much appreciate those nurses that agreed to go and work and give a hand. Now we're going to talk about PPEs. Many of you, the first call we had a couple of weeks ago, we had a lot of conversations about PPE. We had a lot of discussion and concerns about PPE, and we were on it and all over it for weeks, talking to your employer, talking to the government about what is the appropriate PPE. Now, our job as a nurses union is to make sure that our nurses feel safe when they go to work. Our job is not to decide necessarily what is the appropriate PPE. Now, obviously, we have some opinions. Obviously, we've done our homework, both in this province through Paul primarily, as well as nationally through CFNU. They've provided a lot of support for us on what we should be asking for. And for the most part, my understanding, we did ask for the employer, the government, to sign an MOU with us and the other 4 healthcare unions, saying that if I, as the nurse, go in and do a risk assessment of a patient, decide that the PPE that they've offering me, regardless of what it is, I decide that it's not appropriate. I think it's not enough. For example, maybe I think I need more than just the surgical mask. I need the full PPE because of, and that's based on my risk assessment. We asked if the nurse's risk assessment could overrule and not be unreasonably denied. So if my manager said, no, this is what you're getting, and the nurse says, no, this is what I need, that it wouldn't be unreasonably denied. The government did not and would not sign that agreement with us, and they formally responded to us last Friday saying that they do not see that there's a need for them to sign it, because if in our situation, nurses have requested a PPE, they're getting them, and we have no knowledge, is what the government said, where a nurse was asked and denied. There was a bit of a hiccup in Cape Breton 2-3 weeks ago, where nurses did and were denied, but that, quite frankly, was a mistake. That ought not to have happened, and since then the policy and the practices have changed. I'm not defending the employer by any means. However, this is new. This is something, this virus, we're not sure. We look to our infection control specialists within our facilities and public health, of course, for guidance. That's what they're supposed to be. That's what they give us. They are the ones in charge of what are the precautions, what do people need. For the most part, if you're dealing with a COVID positive patient, so the patient is COVID positive or suspected COVID positive, you are to get full PPE. And by that I mean you should have a surgical mask. Many are having face shields now. If not face shields, goggles. You should have gloves, gowns, masks, yeah. And so N95s, ideally, in a perfect world, the position of the nurse unions across this country is that you should have an N95 on. The reality is that is not the opinion of Public Health Canada, and that is the guidance that our province and every other province, quite frankly, is taking. And so their position is the only time an N95 would be used by staff is if you're doing an aerosolization generating procedure. That would be like an intubation, suctioning, cardiopulmonary, CPR, bronchoscopy, sputum induction. So if you are to be in the room where that's being performed, whether you're performing it or not, even if you're in the room, you should have an N95 on. So if you're asked to be part of those kinds of procedures and not provided with an N95, then you should not go in that room. So if you know that they're going to be intubating, you know the patient could be COVID-19 or is COVID-19, then an N95 should be provided as well as the rest of the PPE. I'm being told, or we're being told, that that's not a problem. That is happening, and they are providing N95s. Surgical masks. We have a lot of questions about surgical masks. So right now, the nurses and others are providing surgical masks when they're dealing with non-COVID patients. So if I'm a maternity nurse, normally, so the way I talk to you about this is if you normally wouldn't wear a mask when treating that patient. So if you're a maternity nurse and you're working with all these mums and babes, you need to think, if it wasn't for COVID-19, would I be wearing a mask when I went into this patient's room? And if the answer is no, then that's when they're saying you should have a surgical mask on, only a surgical mask. You don't need the rest of the PPE. The patient is not suspected of having COVID and does not have COVID. Remember, if they're suspected or have it, you get the full PPE. If it's if it's a routine floor or a routine home that you're visiting, you will be provided with a surgical mask. Now, there's a lot of concern and complaint about, well, I should be taking it off and putting on a new one every time I come in another room. I'm not saying it's right. I'm telling you the explanation we're being given is normally if you wouldn't be going into that patient's room with a mask on at all. So we're providing this mask as an extra layer of protection, and so it's not necessary to take it off and put it on between each patient. Now, what I've said very clearly to the employer, and I haven't heard that they disagree, that I'm a nurse, I get to decide whether or not my mask is contaminated. For example, if the patient touched it, if it has become soiled, if it's too moist, it's not going to be effective, I will ask for a new mask, and I ought not to be denied. And I've been told that that is a reasonable ask, and they have not to this point denied nurses asking for a second and a third surgical mask. There is talk that perhaps, that I could keep it till tomorrow. So I get one mask, wear it all day today, take it off, leave it in my locker in a brown bag, and use it tomorrow. That is not the position of public health in this province. It may be in others. Every day, nurses are to put their masks in a brown bag if that's what they've got them in, and they're to throw them in the garbage as they leave the building. The last thing I want to talk about a bit about around PPEs, there is chatter now about perhaps re-sterilizing N95s. So they're going to roll out a program within the health authority that nurses that are using N95s, those would be primarily in ICUs when they're caring for a vented patient, or if they're in some emerge departments, when you use an N95, They're asking staff to just put it in a particular place, and this is not just in Nova Scotia. Across this country, they're looking at ways to re-sterilize it so that N95s can be used again. We've been assured that that's not going to happen until they absolutely have to. We've also been assured that they're going to be 100% sure that it's safe before that they will reuse a mask that has already been used. Not the best. We get it. Everybody gets it. But this is in case we run out of. Because like everyone in this province, no one knows when is this COVID whatever going to end. Is it going to be the end of May? Is it going to be the end of June? Have we hit a peak yet? We only have less than 20 patients in acute care. Are we going to get to 100? Like, nobody knows the answers to those questions, so everybody is on high alert to say we need to start looking at ways of conserving the PPE so that it lasts into the future. What else was I going to say about that? Oh, yes. So one of the most important things about what's as important about having the appropriate PPE and putting it on is taking it off. You know, it does no good to have PPE head to toe, you're all protected, and then when you go out of the room to take it off between patients, you do not use proper technique. That is as dangerous as not having it on at all. So there is a video, I know, at the Health Authority's website with very explicit instructions on how to put it on and, more importantly, how to take it off. Many people are using partners. The other thing I want to tell you, though, is if you're in a situation where you didn't have the N95 on, you're looking after a sick individual, and all of a sudden things don't go so well, and the person has a cardiac arrest, and you need to do CPR and up to the patient has to be ventilated. You're in the room, you're caring for the patient, you have the PPE on. You do not have the N95 on. You must, if the patient is to arrest, you 100% have to leave the room, take off your PPE, and put on the new PPE with the N95. There is no discussion or question about that. You have to look after your safety. You have to put on an N95 if you're doing any of these procedures. If not, you will become ill with the disease, 100%. So everybody knows this is the process. Everybody knows this is the routine. But everybody also knows we're nurses. And that's going to be very, very difficult for us to do. But we don't have a choice. It's like you cannot go into a burning house to save someone without the proper equipment. You cannot you cannot do CPR or be part of any of these procedures unless you have an N95 on you. I want to talk a minute to the long-term care nurses that are listening. Many of you, I hear, are not going to be provided with N95s. You're not even going to have them in the building. You need to make very clear to your employer that if it's not going to be available to you and you get a COVID-19 resident, the employer must have a conversation with someone about the fact that our nurses, our healthcare workers will not be able to be involved with any of these kinds of procedures if an N95 is not available to them. Now, as usual, I'm all off script. Okay, so scrub policies. I just want to go over these really quickly. The Health Authority and the IWK, from as far as I'm concerned, as far as I know, will be providing scrubs that you're to leave there. So you come in with your street clothes, you get your scrubs on, you work your shift, you leave your scrubs there, you put your street clothes on, and you go home. They have decided that nurses and physicians in emergency departments, ICUs, COVID inpatient units, COVID test units, diagnostic imaging will be provided with scrubs that they will leave in the facility when they go home. Some of our long-term care facilities, that Shannock's, for example, Northwood, and some of the other ones, that have some experience with COVID positive residents are doing full PPE regardless. So regardless if the resident is positive or negative, they are providing surgical masks and shields and gowns and gloves for all of the people that are within the care area of their residence. Some of you that work in long-term care in some facilities may not have gotten there yet because you do not have a COVID positive patient. You should, though, talk to your employer if you work in long-term care to ask them, because everyone has an individual COVID plan, and you need to talk to your employer to ask them what the COVID plan is. Residents ideally should not be put in rooms. If you're one of the older facilities that have 2 residents in a room, you should not ideally have a COVID positive with a COVID negative in the same room. Many of you saw on the news that Northwood did, and it's true, they did. The reason for that is because they're so big, 458 residents or something, and now they have, I don't know, almost 200, almost half of them are COVID positive. Many of the residents there were asymptomatic, so they were wandering around doing their thing. You can't, this is their homes, you can't just make them stay in their room, especially if they're asymptomatic. So many of them didn't know asymptomatic. They were out in the halls and touching things, and so that's why Northwood was so challenged. And they have double rooms, and some rooms have 3 residents in a room. Unlike our newer facilities that everyone is in single rooms, they weren't able to cohort the positives to keep the positives away from the negatives. Again, and Northwood's been on the news, so I want to explain a little more about Northwood than anything else today. The reason they're moving, so if I'm in Northwood and I got COVID and now I'm 14, 16, 18 days and I'm asymptomatic, they are moving those healthy residents out into a hotel. And the reason for that is so that they can stop these 2-bedroom, 2 people in a room and 3 people in a room. The more residents they get out, they can super clean those rooms and get them down to only 1 resident in a room so that they're not having the COVID positive mixed with the COVID negative. Refusal to work. As always, the Occupational Health and Safety Act within the Nova Scotia Department of Labour, no one can be forced to work in what they deem is unsafe. So I can't be asked as a worker in this province, regardless of healthcare, I can't be asked to do something that's not safe. For example, if I work for a construction company, I can't be asked to go up and work on a roof without a tie down, without a hard hat, with all the other regulations. It's no different than healthcare. And it's been raised numerous times around PPEs and COVID-19. You do have the right to refuse unsafe work. For example, if I was a nurse and I know this patient is COVID positive and my manager is telling me a surgical mask is enough, we know enough to know that that's not accurate. We need full PPE if we're going to care for a COVID positive resident, someone in their home, or patient in the hospital. So what you need to do, and you can go on our website, and you can send an email to Paul, paul.curry@nsnu.ca to have a conversation with him, or you can call your labor relations person and they'll guide you through the right to refuse. There is a process. You have to talk to your manager. You have to make your Occupational Health and Safety Committee aware. So there is a process. You can't just simply say, I'm not looking after that patient for whatever reason. So I urge you, if you believe that what you're being asked to do is unsafe, not just through COVID, period. If you're asked to look after a patient that is violent and there's no process in place to keep that patient from striking you, then there needs to be a plan, and you have the right to exercise your right to refuse. Shortages. Our understanding we're not getting any official news of how much PPE we have. What we hear is what you hear if you're watching the pressers at 3 o'clock in the afternoon. But what we're told is we have a sufficient PPE to last another month, and there's more en route. everybody knows there's a global supply issues for all aspects of PPE. This is one of the reasons surgical masks is being used in a limited way. Employers are not allowing workers to supply their own PPE, and this is their prerogative. And the reason for that's a standard across the country. That is not new to X long-term care facility. You're not permitted to use your own because they have to make sure that it meets the standards. We had discussions with the employer around conversation as well as the appropriateness of sterilizing and reusing respirators. So I talked about that, reusing N95s, and we're monitoring that closely. We will be asking them for the data on the appropriateness of their decision. Show us what you're doing. Show us the data to support what you're doing. We don't expect that they will refuse us that ask, and if we do, that would be something that we'd discuss potentially with the Labour Board. So we are monitoring that, and other provinces in this country, like BC, are ahead of us on this issue. So I speak twice a week with my colleagues across the country, and we have discussions about this very issue, what's appropriate PPE, what's happening, when you take people off precautions, all those kinds of things we talk about twice a week to make sure that we're all staying or realizing what BC experienced, because out west is way ahead, not way ahead of us, but ahead of us as far as this disease. And so we're learning and watching. Our government is learning and watching from the governments out there, and our unions are learning and watching from the unions. So we're not there yet about reusing our N95s, but the reason some of you nurses are going to be asked to put them in a special container, that's why, that's the plan, is that they are investigating reusing them, and they need to have the supply, so if they decide and they get a safe way to reuse them, they'll have the N95s available. Many of you know that that 80% of the COVID deaths in this country are long-term care residents, unfortunately, and we know the reason for this. If everyone knows that no one in long-term care is there because they want to, they're there because they need the help. They need care. They're not able to care for themselves any longer. They need the care of CCAs who will help them every day with their hygiene needs and all those other. They need the nursing care around medications and assessments, and so no one in long-term care is there any longer because they're healthy. They are primarily there because they're senior or not senior but have some significant health issues. So we know they're vulnerable anyway. We also know that it's very, very difficult in long-term care to stay within your community. For example, you're staying, other than when you go to work, you're staying in a house with your family. Your family is not 200 residents. Your family might be 4 or 5 people within your dwelling. Many Nova Scotians are social distancing, and they understand what that means. Many of our long-term care residents don't understand what social distancing means. They cannot be held prisoners in their own home. So there is limited ability for staff within our long-term care facilities to isolate or social distance our seniors, because quite frankly, this is their home, and many of them don't understand what it means. And even if they understand now, an hour from now, they may not understand. So it's not the same. It's not the same, and therefore we have a vulnerable population. They've got all kinds of issues around their health. They're living in a facility with 50, 60, or hundreds of other residents. So social isolation and staying within your own group or your own home is very, very difficult. So they have a lot of challenges for sure. And we need to respect the fact that, everyone at most of our long-term care facilities have very, very challenging situation when it comes to COVID because of the things I just described. I want to say that all of our staff and most of the administration, if not all, are working really, really hard to try and make this situation as good as it can be. The unfortunate piece is we know that across the country, unfortunately, when a COVID hits a residence, a long-term care residence, 30% of them will be asymptomatic, and that's fine. They'll get it, they'll test positive, and they'll be fine. 20-30% could get very, very ill and may survive. And unfortunately, it's hard to say the exact percent, but 20, and I know my numbers aren't adding up, but 20% plus are going to die, unfortunately, when they get COVID, because they just have so many health issues. And when you look at the number at Northwood, they have 450 residents. 20% is a loss of individuals. And I mean, my heart goes out to their families that aren't able to be with them when their loved one dies. But I feel reassured that we have a staff in there, both ones that we represent, those that have gone in from other organizations, and the staff that are represented by another union in there. I'm feeling really reassured this week. They're telling me that the staffing is better and that they're able to care for the residents because the staff has been so much better, that it's easier now to get to our residents quicker, to make sure they're hydrated and to make sure that they're okay, and checking on them more frequently. So Northwood went through a very difficult time, and we so appreciate the staff. I can speak from NSNU's perspective. The nurses that I've spoken to that have been there since the get-go, they're tired. They've been working short over and over and over again, shift after shift, and their hearts were breaking leaving their shift, knowing that they didn't do the best they could because they were so short-staffed. And normally, short-staffed can be an issue, but when you layer COVID-19 on top of it, and the residents, normally they don't have that many sick residents to care for, and now they do. So it's really difficult. But staffing now, apparently, thanks to a lot of help from a lot of other organizations, staffing is back to a reasonable and very good level, I was told last night by the administrator. So hopefully we can be reassured that even though there may be people, residents that will die in the coming days, that the staff are protected and that there's enough staff there to provide the appropriate level of care to the residents, and people are, although feeling bad, are feeling okay with the care they were able to provide the residents. So it's been really, really difficult with Northwood, and again, I can't say enough about the staff that worked there and stayed there and continued to come to work every day with the challenges they were experiencing. And I'm so proud of the nurses that went to their employer and said, you know what, I'll go help out in Northwood, and knowing that they were going into a facility they had no idea, they had no, many of them hadn't even stepped in Northwood before. And if you know Northwood, it's a big building, it's an older building, it's got its unique challenges. So again, I can't say enough thanks for that. Now I want to talk a little bit about home care. Paul, I can tell you, Paul and Chris are looking at the script, the notes that Paul wrote for me, so that I make sure I covered everything, and they have not a clue where I'm at, because I don't either. I'm just talking. I want to talk a little bit about home care as well. So what the first move that VON did, and I can only speak to VON because that's the only home care that we represent. We represent all of the LPNs and RNs that work in VON in the province of Nova Scotia. It took a while for VON to get down to non-essential home care clients, and we appreciate that. We know that early days in this COVID our nurses were still seeing regular clients for non-essential kinds of visits. For example, it might be a blood pressure check or something that really wasn't essential. And it took a while for VON to get to the non-essential home care clients, and that is not necessarily, well, it's not at all, because so home care clients were supposed to be screened for COVID-19, and they were screened, to be clear, but we did have a couple of occasions where our nurses, unfortunately, would get into the home and the client would say, oh, oops, I did travel recently, or no, my son is here and he just came home from wherever and he didn't self-isolate. So, again, we address those issues early, and VON, the employer, talked to us about being very, very strict, that, and trying really hard to impress upon their clients that they can't be doing that because it's putting the nurses at risk. And it's not that they necessarily would lose care, but that they would better protect the people going into care for those residents. Nurses in VON now have goggles and surgical masks for non-COVID patients. They are to take their mask off. They get, I think, 2 a day. And again, nurses have clinical judgment, and they can decide that the mask is not appropriate, and they want a third one, and that's just fine. They do and should have, my understanding, is a full PPE gear in their vehicle in case they have to use it for COVID-19. So if someone in the home has suspected or positive for COVID-19, VON has assured me that the nurses will have full PPE, shield, mask, goggles, whichever, gloves, and gown. So I've been assured that by VON. If that's not happening, the VON nurses need to get a hold of Angela or Paul, and we'll have that conversation. I think, and many of you saw the care aide's husband make a plea to the country about proper PPEs. I spoke to him this week, and he tells me that he's getting calls from all over the country and the world, actually, Chicago, and apparently he tells me that Nova Scotia, because of his brave plea, will be getting significant amounts of N95s. I haven't talked to anyone at VON at this point to find out how much has arrived, but I called him to thank him because of what he did. We will be getting N95s for sure in this province, and that's good to know. Sick leave. If nurses are sent home on quarantine, and it's usually 2 weeks, 14 days, due to potential exposure, they will be paid. So this is not an issue so much in acute care, where we're hearing this issue, and it wouldn't be an issue for VON. It's the individual long-term care employers. Some of them are saying, no, you have to take sick time. That is not accurate. If you're told to go home because of a potential exposure to COVID and you have to isolate for 14 days, that is admin leave. You get paid, and it does not come out of your sick bank. If they're telling you this, you need to call the office and talk to one of the LRRs. Some workers may be allowed to return before their 14 days is up, and that's up to public health. So public health will talk to you, and this is not up to your employers. This is up to public health. So public health are to give you instructions about when you can return to work. And some exceptions, if you're a healthcare worker and you're symptom-free, sometimes they're allowing you back to work. Ideally, you should be home for 14 days, but it'll depend on the circumstances. I'm getting a lot of conversation and asks about those that volunteer to go to Northwood, for example. I'm being told that if when they finish their whatever they're doing at Northwood. So let's say I decide I work for VON and I'm going there for a month. When I'm finished my stint there, I will go home and be on isolation for 14 days, and that would be paid. If you're unfortunate enough to acquire COVID-19 in your workplace, please apply for workers' compensation. You may never have to access workers' compensation. You may never, ever file a claim. But, well, you will be filing the claim because you're putting in the claim. So you call your manager, you tell them to start the paperwork for workers' comp. Because, quite frankly, we don't know for 100% sure what is there long-term effects for COVID-19. No one knows what it will, if they'll have any effects 20 years from now on my lungs or whatever others. So you need to fill out the paperwork, because if your claim is in and something happens 10 years from now and they can relate it back to COVID, then you will be covered. Right now, we don't have any evidence about pregnant women or can be susceptible to COVID and have worse outcomes. There is no science around that, but our advice is if you're pregnant and you're uncomfortable working on a COVID unit, you may be asked to be reassigned. We've been told by the Health Authority and the IWK and Shanix that pregnant employees should avoid working with COVID patients wherever possible, and they have told us that they will not force a pregnant person to work on a COVID unit. So that's good news. They also have told us that if you're immunosuppressed, you could have cancer and going through treatments potentially and still working. Whatever the reason, if you're concerned about your health needs at all and you would prefer not to work on a COVID unit, you need to have a conversation with your manager. If you're in a big enough facility, like the Health Authority, there's occupational health and safety nurses that will have that conversation with you. And you also have your NP or your GP or your primary health care that you need to have a conversation with them about. This is not to say that you will not work during the COVID-19 pandemic in this province. This means you'll be reassigned. It does not mean that you don't have to work in the facility at all. You will be put in another place that is more appropriate because of your illness. You also, if you meet with your manager and you meet with the OH&S nurse and they both say, yeah, no, that's not good enough, you're going, and you're uncomfortable and you're upset, please call us and we'll have call the union and we'll be happy to chat with you and perhaps chat with your manager on your behalf to have a conversation about why you should not work on the COVID unit. You know, I've had many, many conversations with many employers in this province saying sometimes it could be just anxiety. And it is what it is. Anxiety is anxiety. If I have everybody has anxiety going to work on a COVID unit. Like, there's no question this is an unknown disease. We've watched what's going on around the world. You wouldn't be normal if you didn't have anxiety going to work in a COVID positive unit. However, some people may have a bit of anxiety that is more than just the regular anxiety. Please go talk to your manager and have a conversation to see if you can be reassigned to another unit. Because in a COVID unit, as I explained, taking on and taking off your PPE is very, very important, and it's very important you do it correctly. So, you know, I'd rather not have a nurse that's scared to death, that's got 20% of her brain dealing with the fear and the anxiety, and only 80% donning and doffing her PPE. So, you know, I think that if it's normal, regular anxiety, that's one thing, but if it's super intense anxiety for whatever reason, you need to have a conversation with all the healthcare professionals, and we'll see what we can do. If you have symptoms, we don't do the 811 that you see advertised everywhere. There's a dedicated number for healthcare workers. The Health Authority has one, the IWK has one, and I believe long-term care has the same one as the Health Authority, but I would have to double check that. And once we double check it, I'll ask Colleen to put it up. So the number for the health authority is 1-833-750-0632. If you work at the IWK, there's several occupational health and safety lines, and I won't go through those, but you can find them on your employer site. And long-term care have a number as well. So you don't have to go to 811 and wait through the queue to talk to a nurse to get advice on whether you should be tested or not tested, or whether you should go back. We have our own lines, and you need to use those. At the outset of the pandemic, we advocated, obviously, for the use of N95s for testing and the treatment of all COVID patients. This was based on the precautionary principle. In the absence of scientific certainty, we erred on the side of caution. To be honest, we hoped that public health was right and we were wrong. We hoped that the PPE that they were saying was appropriate and that we were being overcautious asking for N95s in our assessment units. However, at the end of the day, we didn't get them because Government of Canada and employers across Canada decided it was droplet precautions and not airborne. We're happy to say that the precautions seem to be working, and we don't have evidence that healthcare workers are becoming infected when they are employed. Despite that, there's still many healthcare workers across the province who have contracted COVID-19, 95 long-term care staff, 6 healthcare workers in Eastern, 1 in Northern, 16 in Central, 1 in Western. We have no idea who of these are nurses, and we don't have any data from home care about whether or not any of our CON nurses have contracted COVID. All this to say that it sounds to us that the PPE, especially in the assessment, because everyone knows, if they listen every day, our nurses primarily have done thousands and thousands and thousands of swabs. The PPE they've been provided is the one I've been describing through the whole call, and we have 1 in Western, 1 in Northern, 16 in Central, and 95 long-term care. But those 95 in long-term care, there was a significant number of long-term care employees at Northwood that were COVID-19 positive weeks ago. In fact, it's more than 2 weeks ago because they're due back to work this week. So it's more than 2 weeks ago. So that's prior to them having the full PPE. Now, one of the things what I want to talk to you about, and this has been a very, very, very stressful time for Nova Scotians with the COVID. Then you layer on top of that the horrific shooting that happened in my county, in Colchester County, and people staying at home hours and hours that they're not used to. When you do come home, you're restricted to your movement. You can't socialize with your friends. You can't see your daughters, your sons, your grandchildren. It's been very, very difficult for Nova Scotians, but it's been more difficult for our healthcare workers, I would say, for sure, because they're going in, they're facing uncertainty. They don't know, they're putting their family potentially and themselves at risk. They're doing it anyway. They're worried about whether or not the PPE that they're being provided is adequate enough. So there's an added layer of stress on healthcare workers that the average Nova Scotian may not have. I think there's a lot of Nova Scotians out there that are suffering, and I want you to know, though, that you need to recognize and decide that I'm having issues with my mental health. I'm concerned that I'm not feeling good today. I'm feeling kind of down. I'm feeling really anxious. I'm not eating well. You need, your nurses, you need to recognize within yourself that there's something not right about me. And my mental health is not the same. All of those signs that we know, we give advice to our patients and residents and people in the homes every day of the week about mental health, and often we're the ones that ignore the mental health within ourselves. We need to take care of ourselves. Most of us, and most of you have EAP that you can access. We also have family assistance, so it's not me, but it's my husband who's so anxious about me going to work every day, or my husband or my wife, because I'm a male nurse, worried about me going to work every day, unreasonably worried and anxious that something's going to happen. They too, or my children, or my grandchildren, whomever within my family unit needs the help of mental health. Our EAP is available, so your EAP through your employer is available, where you'll be hooked up with a counselor who will help you talk about the issues that you're facing, and or your family member, whomever, that's there for you. Also, it could be financial concerns because your spouse is out of work and you've got 5 children now at home, maybe university students that are all back, and you've got concerns about your finances. They also have financial advisors that will talk to you about this issue. There is also a provincial mental health crisis line, and it's available 24 hours a day, 7 days a week. And you can call that toll-free as well, 1-888-429-8167. I think that's it for me. Should be. I've been talking for an hour. So maybe, Chris, is there any questions?
Yeah, we do have a few questions, Janet. So what I'll do, I'll ask some themed questions. We're getting a few of the same sorts of ideas out there, so we'll ask some themed questions. And just so that folks know that if your specific question doesn't get asked on the call, I will definitely forward those for email follow-up, either by Janet or by myself or Paul or your labor relations representative. So just bear with us, and we will definitely get back to you if you don't hear your question asked. So we've got several questions around vacation. So the first one is, can the employer cancel my vacation because of COVID?
Yes. And you know, they can cancel your vacation not just because of COVID, but they can cancel your vacation. However, they can't just say, you know, for example, if I was asking for next week off and I work in one of the acute care facilities, and as we know, there is a bit of staff in our acute care facilities because we're down to, in some facilities, 50%. So if you had next week off and your manager tells you today, and you work in acute care, we're canceling your vacation, I would have a chat with your manager, because she can't just willy-nilly cancel vacation. She needs to be able to demonstrate to you that they need you as an extra, because obviously it was granted and you were off, and they have to explain to you why they need you back. And if you're not satisfied with the response that you get from your manager, certainly call your labor relations, and together, hopefully, you'll be able to discuss it and come to a satisfactory resolution. So you can grieve, in other words.
Also, am I able to cancel my approved vacation if I don't want to use it any longer?
It's a conversation you can have with your manager, but no. If it's been approved and your manager says, well, you know, I don't need you. Like, I have enough staff for next week or the week after, and I understand. I get it. You had a trip booked and you had a place to go, and now you don't. But if your manager says, yeah, no, it's approved, then again, you can have a conversation with them, but at the end of the day, no, you don't have the right to take your vacation back.
And then the last question, I think, on vacation is that my employer is saying that they are not approving any vacation on a go-forward basis because of COVID.
So that's a conversation that's the big picture. So Chris will, and the labor relations staff will be dealing with the NSHA for sure, and the IWK will be taking that to a provincial level to have a conversation with what is your plans around vacation. We, the Big U union, will decide whether or not that's a reasonable position for them to take, and if not, we will be filing a policy grievance to say you just can't just blanketly say there'll be no vacations. If you work in a long-term care facility, and the same would go for VON, we will deal with that at a high level. If you work in a long-term care facility, then you need to reach out to your appropriate LRR to have that conversation, and they will deal with that on an individual site-by-site basis. But for the big employers, if they're making a blanket statement that they're going to cancel all vacations, we'll deal with that as a union to decide whether or not what they're saying is reasonable. And if we don't believe it's reasonable, we'll be filing policy.
Okay, I am afraid to do a work refusal if I don't get the right PPE because I feel like it would look like I don't care about my patients.
And we get that. We get that a lot, not just with COVID-19. However, the right to refuse is there for a reason. It's there to protect you and your safety. And I get it, saying that I'm not going to care for that patient is hard for us as healthcare workers and as nurses to do. We understand that. However, you do have a responsibility to yourself and to your family to be safe. No one should be expected to do something that isn't safe. No, so I put, no one would ask a construction worker to get up on a roof without a tie-down. No one would ask a firefighter to go into a fire without appropriate PPE. It's not fair that because we're healthcare workers, that we can be expected to do the job without proper protection. You're not refusing to look after the resident or the patient or the client in their home. You are not refusing. You are saying, I'm happy to look after this person. I just need to be protected because I have a responsibility to my own health and to my family. And I should not be expected to be at risk to do my job. If anybody should be feeling guilty, it's your manager. It's not you.
Hey, I work for VON, and I was in contact with a positive COVID patient, and we didn't know that they were positive. Many of us got tested and were negative. VON then advised us to come back to work as long as we had no symptoms. Public health said to just listen to whatever our employer said. I'm confused with, as you said, that we should go with whatever public health tells us.
I understand why you're confused, because public health is supposed to be given the direction. But to be fair, if you're negative and you're symptom-free, the expectation would be for you to go back to work. So that is the advice your employer gave, and that is accurate advice. But I will discuss this with people within the Department of Health. You can't be telling people to take advice from public health and then tell them to take advice from their employer, because all employers aren't the same. And we got to make sure, like we know this now, because some employers are interpreting public health advice in different ways. We have raised this as a concern that we're getting various concerns from our nurses that public health is telling them one thing, 811, even though 811 isn't an avenue that they should have, but they did, is telling them something else, and their employers telling them something different again. And we've raised this several times with government that communication and consistency around messaging needs to improve.
On that note, are nurses allowed to work in more than one facility during COVID?
So it depends, and the preference is no. And many of the provinces out there in the country have made it a no-no. Like even if it's I work at Walmart and I work at I don't know, Glenhaven. But right now it's no. The preference is, however, that if you work in for example, a long-term care facility and you're on a floor with an active COVID resident, the recommendation is you don't work in another facility. My advice to you is to speak with your administrator or your manager about this, to have a conversation. I do know that Shanix would prefer you not, but they would like to talk. They're not going to force you. They know they can't, but they'd like to talk to you about it so that maybe they can augment your shifts or come up with a solution that would allow you to park your other position until we get through the COVID. So various long-term care facilities have various conversations about this, but the strictest word on this is they can't force you not to, because that has not come out as a public health directive to this point in this province. But I encourage you to talk to your manager and see if you can come up with another solution. Again, you can call us, and we'll help if we can facilitate a solution to this with your employer that is satisfactory to you so that you don't lose income.
Okay, recently Ontario has announced boosting wages for healthcare and essential workers. What is happening in Nova Scotia on this front?
Nothing. So what happened in Ontario is the Premier came out and made this declaration that everybody was going, not everybody, some people within the healthcare system is going to make an increase of $4 an hour. In order for us to do it, would be difficult in that we can't just go and ask for it without, we have a very strict process on how we negotiate anything. So we don't negotiate by ourselves. We have a committee. We have a process. We look for, we ask nurses through the survey, many of you know, what is it that you'd like, because we'd be opening the contract. We would, in order to open the contract, we'd have to serve notice to the employer, we'd have to organize the committee, we'd have to come up with resolutions, we would have to give it to government, not government, to the employer, would have to negotiate it, would have to send it out for a vote, because that is the process of negotiations from our Constitution within the union. What's different there is their Premier didn't talk to the unions. He just came out and said, this is what we're doing. So he had already went in and negated all their collective agreements in that province through a ministerial order, so that he can put anybody anywhere at any time. And so they have, their collective agreements pretty much have been suspended. So that gives him the ability to just unilaterally say, let's add $4. The problem or the challenge that Ontario is having with that is it doesn't apply to everybody. So some nurses are going to get it, some nurses are not going to get it. There's big gaping holes in some of the nurses that weren't going to get it from ONA's perspective that should be getting it. So it's really taken their eye, some unions' eye off the ball, because now, their nurses obviously are concerned. Those that aren't getting it are saying, well, why am I not getting it? I'm doing this, that, or whatever, and I believe that I should be getting it too. And so because ONA didn't negotiate that, they didn't make the decision who was getting it and who wasn't, Ford did. And so right now, from our perspective, we're concentrating on continuing to make sure that we get the proper PPEs for our nurses, make sure they feel safe at work, make sure that the supplies is there that they need. There will be a day that, and it's coming soon as we get out of this, that we will be going to the table to negotiate wage rates for all our nurses. And they won't be temporary for 4 weeks only, or sick, whatever Ontario. So Ontario has applied this wage rate, and I don't know, 16 weeks, I think, it stops. So the wage rate is not permanent, it's a premium. And so I'm not saying it won't happen here, but it will happen if the Premier applies it. But my caution is, and concern is, who gets it and who doesn't, and who makes that decision, and how is it made, and under one. So it's not just that easy. Personally, I think most healthcare workers in this time that are in any setting is putting themselves at risk, because you never know whether you're dealing with a COVID positive for sure or not. I mean, there's always a risk because it's such an infectious disease.
Okay, can the IWK staff be reassigned to other employers? The Good Neighbor Agreement is predicated on any such reassignment being strictly voluntary. Is the ministerial order forcing the NSHA staff to go to Northwood applicable only to NSHA, or is it to the IWK as well?
It's applicable to everyone. The application was with the nurses from the health authority. They used that ministerial whatever to move them to Northwood, but they could do the same thing with the nurses from the Aberdeen over to Glenhaven. That's why we came up with the Good Neighbor policy in the first place, because that was strictly volunteer. They can't call what they've done with those nurses from the health authority, those specific nurses. They can't call that the Good Neighbor policy, because it's not. The Good Neighbor policy is I volunteer to go. Not that I'm going to not get paid, but I put my hand up and said I'm willing to go. That is always and will always be the preference of the unions. I need you to know that all 4 unions are going to challenge that ministerial order with the labor board, because it is our view that you can't, that those nurses have collective agreement rights, and we have languages in our collective agreements, all of them, on how we move people within the system. And that language was not addressed. The collective agreement was ignored. That's the whole purpose of the ministerial order. However, we don't believe it's right, and we don't believe that they had the authority to do it, and we are challenging it, all 4 healthcare unions.
Okay, when a nurse is reassigned to an area where the rotation is different from their current workplace, is the 60-day notice period required that's in the collective agreement?
So I think the question is, I work 8-hour days, and now my unit is closed, and you're asking me to go work on another unit that might be 12-hour days?
Correct.
No, 60 days, no. That is not applicable. I believe I'm right on this, Chris. It's
correct.
Like
yes.
You can have your schedule changed with 48 hours notice.
Yes.
So even today, without COVID, put COVID aside, you could come to work on an 8-hour unit, and they could look and say, oh, look, this is ambulatory care, and next week we have no patients. So, Janet, we're going to put you on the medical, this is Monday. Next Monday, you're going to go work on the medical day, which is 12. And they have the right to do that, COVID or no COVID.
And typically with a full, I'll just add to that too, Janet, typically with a full rotation change, that's where the 60-day notice comes in, is that it's a permanent change and your rotation is changing as such. This being an emergent situation, the employer has, the IWK as well as other employers have been working with nurses to say, we would like you to start on this date, but if you can't start on that date, let's figure out what will work with you, what will work for you, because if you have childcare or other responsibilities that, wouldn't allow you to change on the date that's requested, they're working with you as the nurse that's being told that they have to make those changes. Hey, I am immune compromised. I have severe asthma. Am I able to request to wear an N95 because of this?
No. N95s are for the position they're having is N95s are for aerosolizing procedures. So if you have severe asthma, first of all, you might want to chat with your manager to say, I'd rather not be anywhere near a COVID positive patient. Have that conversation if you have severe asthma. Talk to your GP or your nurse practitioner, whoever your primary health care provider is, to have that conversation. But unless and until nurses are asked to be part of, not just part of the procedure, but in the room where the procedure is being done. So you might not even be doing the procedure. That is the only time that N95s are being worn by the nurses. So unfortunately, no.
Okay, we've just got a couple more questions here, Janet. So this one and then one more, I think. Could you please clarify for me about employees not working in two locations? I am wondering if we are sending employees for a few months to cover COVID units, should they then be taking 2 weeks of isolation when they return to their home facilities?
So yes, ideally they should be. Again, it's a public health decision, but my understanding, if at all possible, so if I work for VON and I go work in a COVID unit, when I go back to VON, I should be taking a 14-day isolation period. And when we say isolation, it means isolation. It means in your house, right? Because that's what isolation means. So you get 14 days where you go home and you stay home. It's no different than if you're coming from another province. If you come from another province to Nova Scotia now, you come home and you stay home. You don't go for walks, you stay home. So there will be a 14-day isolation most of the time. My understanding, though, is I don't understand how this could happen, if I went to work at, Northwood's the live example, I went to work at Northwood and I was there for 6 weeks and I'm coming back and I'm asymptomatic, I don't have any symptoms, I tested negative. The exception would be they absolutely critically needed me from whatever employer I came from. And the reason I'm saying I find that difficult is most employers wouldn't have freed me up in the first place if the staffing was that short. So most of the staff that are going someone has made the decision that they're not required and that they're able to free them up. So hopefully we won't get in that situation, but that could be, if unfortunately volunteers and then we get all these hospitalizations because COVID all of a sudden hits our acute care, there's a possibility that the nurses that went to a COVID unit could be asked, if they're negative and they're asymptomatic, to go to work with full PPE.
Okay, this is the last question for you, Janet, and I'll just remind folks that are on the line that if your question hasn't been asked and answered on the call, it will be forwarded to someone for a personal reply by email. So the last question for today for you is, there are many nurses that are being reassigned to other sites in the hospital that do not have COVID-19 cases. They just have chronic shortages all the time. Is this allowed under the contract?
Yes. So whenever, we knew this was going to come when our clinics were being closed, our Monday to Friday clinics, our ambulatory care, our ORs were going down to emergency care, emergency operations only. We knew that there's going to be excess nurses within the system. And we knew, just like when we ramped down a bit for holidays and Christmas, the employer has the right to send nurses where they're needed. So if there's a need on another floor, you're not hired by the unit. So your employer is not ambulatory day unit. Your employer is the IWK or the Nova Scotia Health Authority. That's your employer. And so they get to decide, and they have to be reasonable, they get to decide that they can move you to another unit. However, there are some obligations on the employer. They can't send you to a unit that you've never worked on before in your life. You have no idea where anything is, the linen closet, nothing. They have to provide you with an orientation, and they cannot ask you to do something that you've never done before. So if they send you to, I'm making this up now, a renal dialysis, and you've never, ever had anything to do with renal dialysis, then I suggest the only thing that they'd be able to have you do is maybe do some care but nothing to do with the renal dialysis. So they can redeploy you to another unit, but you need to be comfortable within your license and within your practice that what they're asking you to do, you're okay to do, and you feel comfortable doing it. There's no other questions.
Nope, there's no other questions, no.
So we're going to wrap up, but I have one thing that I want to talk to you about for 1 second. Now that people are positive. We've had some time and space. It's been, I don't know, it seems like 6 months since we've been in this, or 2 years. We've had a bit of time. People are starting to get through their 14 days and potentially 21 days. And conversations are happening now about when is it safe to take PPE off, like the precautions. So I'm looking after a resident, and they were positive, and now it's been 3 weeks, and we're still using full PPE. This would be probably mostly in acute care, some long-term care facilities, but the bigger long-term care facilities, Shanix, for example, are going to transfer them into a COVID unit, and then eventually, when they're better, going to transfer them back. There's been lots of conversation about what criteria do we need to have to send them back to their original home. Our position is, the nurses union, is they ought to be symptom-free for sure, so they have no more COVID symptoms. And secondly, we're asking that they get tested twice and they get 2 negative tests back. So before they transfer them back to their home in the other unit, or take them off precautions in hospital. So that's our position. So far, so good, but like everything changes on a dime. Today they have infection control will say something, and then next week there's something different. For example, surgical masks weren't necessary, now they are. So in fairness to everybody, it's an evolving illness. We're learning more and more about it. Originally, no one thought that someone that had no symptoms would be able to pass it on. We know that's not right now. We know that I could have no symptoms, I have no cough, and I'm still able to pass it on. So we're finding out, infection control people are finding out every day. That's why we get so frequent changes in positions. So I can trust me when I tell you we're on it. We're on it nationally. We're on it provincially. We're keeping you as up to date as possible. I know you're inundated with all kinds of communication from NSNU, and then you're getting all the COVID updates from the province, and you're watching the pressers, and there's just so much around this. And I know you need to pick and choose, but we are trying very, very hard at NSNU to make sure you get the best up-to-date information. As soon as we know something's new and different, we're telling you it's new and different. And more importantly, we're on the horn talking to your employers, talking to government, talking to people to say, this is our position on whatever. And for the most part, we're getting good feedback from our employers. They're listening. They're taking into consideration whatever it is we have to say. The immunosuppressed, the pregnant nurses, all of those issues were raised by unions. All of those issues, for the most part, they've agreed to. So I do have to say that we're in this together. It is a cooperation between unions and employers and our members. But you are on the front line. You're the one doing the work. You're the one taking the risk. So you, as a nurse, need to decide, what risk am I willing to take, and what do I need to do to make this risk minimized? And if you're not getting that, you have the right and you have the obligation to not only yourself but to your family to make sure that you're properly protected. The job of the union is not to protect the patients or the residents. We care about them, and we know you care about them. Our job is to protect you, to make sure you feel confident given the care that you're giving Nova Scotians. And the least anybody can do is to make sure you go to work, you feel safe, you are safe, you come home tired but safe to your family after your shift is over. I'm pretty sure Linda Silas is listening in, and CFNU has a lot of information on their website as well around COVID. They have a lot of national standards. Linda is working with us, the nurse unions across this country, as well as the other unions within healthcare, to make sure that national standards, that the federal government takes up their responsibility in this COVID pandemic. And the one thing I will tell you, if there's anything good that comes out of this COVID, finally, remember broken homes? Remember we put that out several years ago, and we talked about the staffing levels in long-term care. We put another paper out talking about the staffing levels in long-term care. We've said for years that the staffing levels in long-term care need to be addressed. The whole country, in fact, the world is seeing now that this is true, because a little COVID, no, I shouldn't say a little thing like COVID, but putting COVID on our long-term care system has showed how poorly staffed our long-term care is and has been. It's been 20 or 30 years since staffing has been looked at in long-term care in this province. And I dare say after this is over, as I said, if there's anything good come out of it, finally, people, including our governments, are seeing what's happening in long-term care. Nobody could have prevented COVID, but the response could have been better. We shouldn't have been in a position where we needed hundreds of people to go in and help Northwood get through this crisis. The reason that had to happen is because the staffing level, and I'm talking about the regulated staffing level, the staffing level that they've been working on for years, wasn't adequate. When you take 20, 30, 10, 15 people out of the system, you can't cope. We had at least one unit in acute care where we removed 20 people out of a facility, and there wasn't a blip. We can't do that in long-term care because our staffing is so poor. So hopefully, I think now Canadians get it. They understand. And I think now governments have realized and quite frankly are embarrassed about the staffing levels in long-term care. I heard the Premier say on one of the pressers, we will deal with this post-COVID. I hear lots of politicians across, including the Prime Minister, saying that staffing in long-term care, they realize now it's an issue. Unions have been saying it for years. Finally, I hope that our long-term care residents get the respect they deserve. Thank you for joining. I sound a little preachy there. Sorry, but I've been talking about long-term care staffing since I became president. So, it's just terrible. And my admiration for the long-term care staff always was great, but it's incredible now at this point and what they're going through and how they continue to get up every day and go to work tired and scared but loving their residents. Anyway, we will have another one of these probably 2 weeks from now. If you have any questions or concerns between now and then, let me know, and we'll make sure that whomever you need to talk to, you get to talk to. We have, as you know, Nursing Week is coming up, and it's not going to be the same Nursing Week as normal. We will be having our usual TV ad. I can assure you that all the social distancing was done, but we felt it very, very important as an organization that we have and acknowledge this year in a very special way that what our nurses have done. Happy Nurses Week, and thank you so much for everything you do each and every day. I say again, I'm so proud to be with you through this and helping you get through this. NSNU is so proud of every single nurse we represent. Thank you for what you do, and we'll talk to you in a couple of weeks.